Testing MC joint extension. Patient's palm will be on the table with fingers hanging off the table, as shown here. Rachel, I'd like you to perform a bear claw with your fingertips and extension here at the MC joint. Very good. Because she's able to perform this, we know that that is at least a grade 3. Go ahead and go about halfway again with that, with the bear claw again, Rachel. Okay, I'm going to stabilize the metacarpals, all 4 of them, and then I'm going to apply resistance on all 4 proximal phalanxes at the same time. So go ahead and resist me, Rachel. 3, 2, 1. Depending on the resistance she gives me, I will grade her as either a 4 or a 5. Testing MC extension, gravity minimized position. You'll have your patient's forearm resting on the table as well as the medial aspect of her hand. Rachel, what I want you to do is I want you to slightly ball up your fist for me and then extend it outward, but keep your fingers in a claw-like position. Very good. Because she was able to perform this in a gravity minimized position, that would be a grade 2. If she was not able to perform this motion, I would come up here and I would palpate for the extensor digitorum. If I feel the muscle firing, that is a grade 1, and if I do not feel it firing, that is a grade 0.